Hello everyone, welcome to Pharmacy in Our Lives, a pharmacy show sponsored by Guihun Media and Pleasant Care Pharmacy, a locally owned health mart. My name is Dr. Chau Phan. I am the main host of the show. It's my pleasure to be here today to educate the public about different health topics through the perspective of a pharmacist. And the goal of our show is to encourage viewers to be more aware of their health and wellness by educating on common health topics, drugs, or pharmacy-related topics. And many of the conditions that we will discuss on the show are preventable and can be managed at home if everyone can understand how important it is to comply with treatment, which includes not only medications, but also lifestyle changes. Now today, I'm very excited about today's topic because we will be talking about the cost of medication, and we know that it's skyrocketing right now, and you probably, the viewers, want to know why it's so high and how we can help you save money on your medications. So sitting with me today is my colleague from Peninsula Pharmacists Association, Dr. Giselle Leung. Dr. Giselle Leung, welcome.
Thank you.
Yes, so she's a friend of mine, and she is a board-certified geriatric pharmacist. She graduated from the University of the Pacific in 2014, and she currently works at Walgreens Pharmacy. So before we start, I wanted to just go into a little bit of the background of what's been going on for the viewers. So during the last decade or so, you probably came across some very sensational headlines in the news about prescription drug prices, such as the price of ancient gout remedy, which went up to 2,600% after the FDA gives approval to a drug that has been used for thousands of years from the Daily Mail UK. And this medication we're talking about is called colchicine. This is a very old medication, but all of a sudden the price went up like crazy. Another one is there's a drug that goes from $13.50 a tablet to $750 a tablet overnight. And this one is from the New York Times, and it was published in September 10th, 2015. So as you can see, as the drug costs soar, people then start delay or skip cancer treatments. And there's an article about it from the NPR Health Shots that was published on March 15, 2017. Another big news was Mylan, the manufacturer, very famous manufacturer, drug manufacturer. They were hit with racketeering lawsuit for hiking the price of EpiPen, and you can see that also in CNBC, and that was published in April 3rd, 2017.
Wow, just thinking about it, these prices are just outrageous. I don't even know how patients and anybody can even afford this medication.
That's right, that's right.
So let's just put some of these numbers into perspective. So according to the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services, in 2016, they published a report called The Observations on Trends in Prescription Drug Spending. About $457 billion was spent on prescription drugs alone in 2015.
That's crazy.
And that number is expected to grow to $535 billion this year alone. And just to give you some more background, these numbers include drugs that are purchased by consumers, also by medical providers such as hospitals.
So the whole point here we try to get to you is that these things are good for drug companies, but they're not so good for the consumers. And another player that the viewers may not have known is the prescription benefit managers, also known as the PBMs. Now, what about consumers? How do they pay for their prescriptions? So Giselle, if you don't mind telling the the viewers, how do consumers, how do the whole prescription drugs work?
So I just wanted to highlight some kind of changes in how patients and customers are, how some of their changes are in their lifestyle. So on the consumer reports, they show that a change with high drug prices causes people to either delay their treatment or even skip appointments. And if you can see on the slide there, it shows you that more people are skipping back on entertainment, even groceries too. So a lot of times they are preventing, the drug prices are preventing them from actually enjoying themselves or even improving their health, and even delaying their retirement, which is kind of outrageous here.
Yes, sometimes the unfortunate fact is they have to make a choice between whether they can, save a little money for retirement versus, paying for the cost of the medications,
Right.
And that's really sad. So, what is the cause of high drug cost? So, in this picture, you're going to see what we're going to put up here. It involves many players and factors. So, we're going to focus today on two major players: the drug company and the PBMs, and how they affect you. Okay.
So in this next diagram that you see on the screen, it highlights the dispensing process. So drug A produces a brand new drug called drug A. This is a brand new medication and is the only medication on the market that treats your health condition. Drug A was recently approved by the FDA, and so the drug company now has a patent granted by the FDA.
So I wanted to interject a little bit and just tell the viewers that this is a hypothetical situation. So we're giving you a drug A, and it's not real, but this is how it usually works. And before it even gets approved, they have to go through a whole clinical process, new drug application to the FDA to get it out into the consumer side. But once it's approved, then it's going to cost a lot of money. Yes.
Yep, and then when they have that patent law, most of the time the drug company tries to maintain it or at least, make the most money off of that. So basically, the drug company is able to set the price of drug A and just change it according to market demand. So it's very normal to see a medication there out on the market for a number of months, but then they decide to jack up the price again.
Right. Well, the reason for having such high drug costs is because they did spend a lot of money on the drug development process and a lot of clinical trials, and that costs a lot. And so they need to be incentivized to recoup that cost so that they can further use that money for other new drug development. So, in a way, I do understand why the beginning of it, they should be able to try to recoup all their loss or their investments. But now we wanted to go into more of so how does that whole process, now that there's a drug now available in the market, how's that affecting you, the consumers, right?
And in this next picture, we kind of see how drug A arrives at the pharmacy. So basically, drug company produces the drug A and then they sell it, they produce it for only $100. But then when they sell it to the wholesaler, which is the group that sells the medication to your retail pharmacy, they sell it to the wholesaler at $500, which is the market price they agreed on. And then after that, the pharmacy buys drug A from the wholesaler at a higher cost, say like $600. That's the list price plus possibly a 20% markup.
That's right.
And then after that, the drug is dispensed to you, the customer. So it's from this whole process, it's very difficult to tell what is the real price of the drug from that aspect if you don't have the insider information. But
the chemical itself could be really dirt cheap, right?
Right.
But because the drug company spent all that time development and clinical trials, that's why even if it cost them only $100 to make, but they're gonna charge to the wholesaler at $500. The pharmacy will then get charged even more because the wholesaler got to make money too. So then the wholesaler ends up, charging the pharmacy $600. Well, the pharmacy got to make money as well.
Yeah.
So then that also trickled down to the consumer, which means you're going to have to pay more than $600 for that drug A, right? So now when you go to the pharmacy to pick up drug A, you have to pay for the copay, which is what you agreed with your insurance for drug A. And then also the pharmacy will then get reimbursed by your insurance company. But not most of the time, your insurance company is not the one directly paying the pharmacy. It's through the PBM. So the next topic we're going to talk about is how the PBM is contributing the high cost of drugs.
So when PBMs were first created, they were considered a middleman that negotiates the prices. So they're going to talk to the drug company and see if they can get a rebate or a discount for that new medication, so that on behalf of the drug company, health insurance company. And so by doing that, then they will be able to put drug A on a preferred drug list, also known as a formulary. So basically, this whole idea of PBMs was supposed to lower drug prices.
That's right.
That's what we thought.
You're right.
But unfortunately, that's not the case. As you can see here, we have problems, multiple problems these days on savings and rebates, and discounts are not often shared with that health insurance company, because most likely the PBM has their own financial interests too. They want to make money too. So they're just going to hold back some of that money. Chau, did you ever hear what happened in the news recently?
Yes, I heard about that. It was so crazy. I guess in 2016, Express Scripts, they generated $100.6 billion, and CVS Health, $177.5 billion, and Optum RX generated $60.4 billion in annual profits. I mean, we're talking about billions of dollars. These are the PBMs that are making money, and I don't think any pharmacies have ever made that list, right?
Nope.
So, and this is these data is found by NCPA, which is a National Community Pharmacists Association webpage on the PBM resources, and recently, I want maybe Giselle, you can tell the consumer about this most recent in June 2018 with what happened.
Sure. So in June 2018, the Ohio Department of Medicaid was trying to release a report detailing how PBMs overcharge taxpayers for their medications. So they had issued a executive summary that shows that PBMs billed taxpayers $223.7 million more for prescription drugs in 1 year. Then they reimbursed pharmacy to fill those prescriptions. According to them, that is a 8.8% difference. So this difference is actually called a price spread. And that represents so many millions of people under the CVS Caremark plan, which constitutes about 4 of Ohio's Medicaid's 5 managed care plans, and also Optum RX, which is the other managed care plan that they have. So currently, their CVS Caremark and Ohio Medicaid are in the court, and they are trying to discuss what can or cannot be disclosed in that report. So we'll find out more on July 25th, 2018 on how much are we going to see from that report.
Well, and that will shed light for the consumer to see that how the PBMs are keeping the money instead of actually, passing along that savings back to the consumer, or maybe even back to the insurance, the employers who are paying for this. Because their role, again, in the beginning, just like Giselle said, was meant to save the employer's money and to maintain and keep the price of drugs low. So now I'm going to show you guys a realistic example of the diagram. Okay, so in this diagram, PBM, so you will see that the PBM receives money from the employer. So let's say, let's choose a big employer here. Who should we say? Like, who's a big employer?
McDonald's.
McDonald's. Okay, so let's choose McDonald's. McDonald's has thousands of employees, right? And they want to give health insurance as well as prescription insurance. So then McDonald's will then say choose a insurance company like, let's say, Anthem to do that, or let's say, yeah, like, I guess Anthem would be a good one. So Anthem Blue Cross, they would choose Anthem Blue Cross to monitor and dispense this. And so McDonald's would then pay Anthem Blue Cross to make sure that Anthem Blue Cross will cover all their employees. Now, what Anthem Blue Cross does is that they will go through another PBM for prescription benefit manager, the middleman, to make sure that this PBMs will keep all the pharmacies' prices stay low. Okay, so all the McDonald's employees, when they go to the pharmacy, they pick up the medication at the pharmacy, but it's not Anthem Blue Cross that pays the pharmacy. No, it's the PBM in the middle that pays the pharmacy. I just want to give you the big general idea like that. So now, when the Anthem Blue Cross pays the PBM, then the PBM then pays the pharmacy. But what you notice in between is that the PBM also gets kickback from the drug company for putting on certain medications on the formulary. Let's say, this medication, this disease state, let's say hypertension, could be easily treated with a generic. But then because there's another drug company that wants the PBM to say, well, to tell the pharmacy, I want you, don't dispense generic. I want you to dispense the brand, this brand.
Yeah.
And so instead of the pharmacy, can save the consumer and the Anthem Blue Cross, hence McDonald's, money by saying, okay, let's just give them generic medication. They end up giving them the brand. So then the drug company, the brand drug company, for every medication that the insurance company tell the pharmacy to dispense of that drug A, they get a kickback. Now that kickback is not transparent at all. So we don't know where that money goes. I'm pretty sure, like you saw earlier when that example from Ohio Medicaid, there's an 8.8% of price spread. So that money gets kept by the PBMs. They don't get dispersed back to the consumers, not saving any money, nor Anthem Blue Cross or McDonald's even they can save any money. So that's the issue right now that we have. And so on the diagram, we want to show you how that the whole idea works is that the PBMs is currently right now holding all that money without, dispersing back. The thing is, I mean, from an entrepreneur, and I do own my own business too. I mean, we all are in business and we all should save money. But I think what's happening right now is the PBMs lost their original intent, and that they, instead of help saving the cost of medication, it ends up just making it worse and worse. And that's why there are a lot of laws right now that's pushing for the transparency of PBM practices. The other problem is that the PBM may even charge the health plan, like I say, like the Anthem Blue Cross, a higher price for the medication and reimburse the pharmacy at a different price. So there again, you get the price spread one more time. Not only they get the rebate from the drug company, but they get the price spread from what they charge the McDonald's employer and what they actually pay the pharmacy. They keep everything in between. End result, a very complex problem that everyone, including the pharmacy and the consumers and the insurance provider, even the employers, everyone is affected. And that is a huge problem right now. So currently there is legislation in the works, California legislation SB 17, healthcare. It calls for prescription drug costs that pass, and it requires 60-day notification of price increases over a specified pricing threshold, and it mandates that health plans report the percentage of premiums spent on prescription drugs, and according to the National Academy of State Health Policy. Also, there's another one called Patient Right to Know Drug Prices Act, S2554, is currently being introduced into Congress and meant to remove the gag clauses that prevent pharmacies from informing patients of the cash price of their prescription. So right now, I don't think the consumer knows what the heck I just said. So Giselle, do you want to explain that a little bit?
Sure. So when you go into the pharmacy, most often you're just given the prescription and they tell you that this is your copay that you're going to pay. But have you ever thought of asking your pharmacist what is the real cash price for that medication? That would actually be a good way to compare the prices of how much you're actually paying with the copay and also what the actual cash price of the medication is.
That's right.
So the gag clause initially was created to prevent pharmacists and pharmacies from telling consumers how much their medication costs, all because the health insurance plan didn't want to lose out on that money that they were going to get for that prescription, when actually the patient could have saved more money.
That's right.
And there was a really good article in May 2017 by AARP. They had a really big cover story on why drug costs cost so much. And it has a really good overview of this whole problem that me and Chau just discussed here today. So that's another resource that I highly recommend you look into as well for better understanding.
So by now you are probably wondering, how can you save money on your medications, right? Well, we're going to have some suggestions for you, so stay tight. Giselle, do you want to tell the consumers how they can save money?
Sure. First things first, always use the generic product. And just so you know, generic drugs are approved also by the FDA, and they are working the same way as a brand name drug. And a lot of times, these medication cost about 80 to 85% less than a brand name drug. So I have a table for you that kind of gives you a comparison of the prices. So as you can see here, it says atorvastatin 40 milligram, which is a medication for cholesterol. And note that the cash price is significantly less than a brand name Lipitor. You can actually save about $378.38 if you get the generic.
Yes, that's right.
That's pretty impressive. Now, I have another example there on the table as well for gabapentin 300 milligrams, which is a medication to help with nerve pain. And you can actually save about $152.04 if you get the generic. And all these prices I had checked on goodrx.com, which is another great resource we'll briefly touch on later in the talk.
Another suggestion for you to save money is to speak to your pharmacist or doctor about your concerns. Now, pharmacists, they're very knowledgeable when it comes to drugs and may be able to recommend an over-the-counter product, also known as OTC, that is appropriate for you. And an OTC that does not require a prescription and can help you with the symptoms that you're experiencing. So that could help potentially save you money. And now when your drug is not covered by your insurance, the pharmacist or your doctor can check your insurance plan's formulary and they can help you find an affordable alternative. Now, if there are no alternative available, then the doctor can even complete a prior authorization form on your behalf to ask the health insurance plan to make sure that they cover it for you.
Now, Chau, what if my drug is not covered by the insurance, but I have a really, really high copay that I can't even afford? Is there another way for the insurance to cover that medication?
Yes, of course. So that's a great question. The doctor can call your insurance company to see if the insurance will cover the medication under what is called medical necessity. Yes. So you can definitely ask for that.
And another suggestion is to really look into what your insurance plans entails. There are 3 types of insurance plans out there that we commonly know about. It is Medicare, Medi-Cal, and any commercial insurance that's through your employer. In general, for any kind of insurance that you have, it is always recommended that you use the preferred pharmacy that's in that plan's network. This will ensure that you get the lowest cost on all your medications. For Medicare beneficiaries, just so you know, Part A and B covers hospital and inpatient stays. Now, the prescription part of it is called Medicare Part D, like David. That prescription drug plan may allow you to qualify for patient assistance programs such as PAPs for brand name drugs and other copay assistance programs. Just don't forget to read that fine print to make sure that your insurance plan will allow you to do that.
Now, if you have Medi-Cal or Medicaid, in fact, most over-the-counter products can be covered. And if you have both Medicare and Medi-Cal, then make sure you bring both of your cards to the pharmacy and you show them to the pharmacy staff, because in that case, a lot of your stuff will be covered as well. I mean, you still have a little bit of a copay if you're Medicare, Medi-Cal. We call them Medi-Medi, and but you can save a lot of money. Yes.
And if you have commercial insurance or insurance that's through your employer, or even covered California if you're here in California, you can also use copay cards for brand name drugs, and they most often are found on drug manufacturer websites, or you can even get them from your doctor. If you still need help with copay assistance, I highly recommend you check out this website called www.copays.org. They have a lot of good resources there. Now, for help with Medicare, I think you should check out the Medicare.gov website. That one has a lot of important information that will help you. For even more help, try the National Council on Aging Benefit Plan Evaluator tool at www.benefitscheckup.org.
Okay. And Giselle, what should the consumer do if they do not have insurance? How can they get the best possible cost on their medications?
Great question. So there is a government-affiliated pharmacy out there, and that is Better Health Pharmacy here in San Jose.
Pretty new.
Pretty new,
yes.
Pretty new.
It's been around only a couple years.
Yep. and it gives out medications at no charge. All you need to do is to bring in a valid prescription and just check with that pharmacy to see if they have that medication in stock. Plus, I would highly recommend checking out their website and policy for more information.
I don't know if do they help with like people that are not here legally?
That's a great question, but I would imagine they do. It's
Yes.
another great resource for people who really need help.
Who really need help that
Really need
cannot even get health insurance because they're not here legally.
That's true.
And then they can apply for Medi-Cal or other insurance. So for those who can apply, they I was actually told that even if they are not here legally, they can still apply for Covered California.
Very good.
Yes, so they apply for Medi-Cal or other insurance like Covered California or insurance through your employer. And now if you need help with Medi-Cal, check with your local county office. And if you are eligible for Medicare, you can even work with HICAP. And this is what it looks like. This is HICAP San Mateo County, but I'm sure other counties will have their own HICAP as well. And HICAP stands for Health Insurance Counseling and Advocacy Program to help you apply for Medicare. And HICAP, like I said, has offices in all of California counties. And you can check them out at www.cahealthadvocates.org/HICAP. And for a list of offices, then you can call 1-800-434-0222. So probably at this point, you have tried all that we have mentioned earlier in this talk. So what can you do next? Do you have any recommendations?
Yep, I definitely do. I would also recommend you do a bit of homework and just try to find the best cost for your prescription drugs. And some of your great resources are your pharmacists and your pharmacy. They can tell you the cash price of prescription medications and the prices for a 30-day supply versus a 90-day supply. And basically, this overrides the gag clause that I was talking about earlier. And plus, your pharmacist might even know if there's any discount programs at your local pharmacy. Most retail pharmacies and independent pharmacies offer drug discount programs. So find out more from them, and just some of them may even have membership fees. So find out more from them and check out www.needymeds.org for other additional resources.
Okay. Now, lastly, there are websites that help compare drug prices and may even generate drug discount coupons. So we're going to give you 3 websites. The first one is called GoodRx, and GoodRx has an app as well.
Yep.
So you can download the app and check out your local pharmacies where you can get the best pricing. There's also one called Blink Health and Needy Meds. I believe Needy Meds also have an app, right?
Yep, they do.
Yeah. Does Blink Health has an app?
I believe they do. They're a fairly new website, so just check it out.
Just check it out. Yes, so check them out and see where you can find the best pricing for your medications.
And the final suggestion we have is the patient assistant programs, also known as PAPs. And these are typically used for brand name products. PAPs are basically sponsored by the drug company that made that product. And rxassist.org has a helpful database that compiles the list of all those current programs and also more information on how to use it and what are the fine print that you had to look at. So to apply for a PAP, you need to fill out a form with your doctor's assistance to determine if you're eligible. Some programs do have restrictions based on your insurance, so make sure to check that out carefully.
That's right.
Once it's approved, then the drug can be mailed to your residence or even to your local doctor's office.
Well, I mean, that was a lot of information, and thank you so much, Giselle, for coming here and representing our organization, Peninsula Pharmacists Association. And to you consumers, I hope you enjoy what we've said and find it very helpful. So thank you again for watching Pharmacy in Our Lives, brought to you by Guehung Media and Pleasant Care Pharmacy, a locally owned Health Mart pharmacy. We hope that you find the information useful. And once more time, thank you, Giselle, for being here and co-hosting with me. Did you have a good time?
Yep, I sure did. It's my pleasure to be here.
And you are a natural. You should come back again. So if you have any questions or suggestions, please email me at chau.fan@pleasantcarepharmacy.com, or call us at 510-200-9984. We have pharmacists and pharmacy students help answer your questions free of charge. You can also visit me at www.pleasantcarepharmacy.com. And thanks again for watching, and I will see you next time. My son, at 3-month-old, he had really bad eczema. It was all over his face, his body. Sometimes at night, he would wake up and cry, and we would find him covered in blood from scratching himself. I took him to his primary care physician, an allergist, even a dermatologist, even trying naturopathic doctor. And through all those, most of the Western doctors, they prescribed to him steroid cream. And being a pharmacist, I know that steroid cream long term is not good for my son, so I don't want that to be his treatment forever. I tried really hard finding a solution for my son, and I couldn't find anything that really helps him and maintain his eczema. So when I was able to open up my own compounding pharmacy where I can create creams and come up with formulas myself, then I said, well, that's the first thing that I'm going to do. I'm going to try to find an alternative cream that doesn't have long-term side effects that my son can use for a long time every day. So my cream, after I use it on him, he has now improved up to 90–95%. With that in mind, I wanted to help other people that have skin disease and skin problems that just couldn't find that solution.
My acne was very, very bad. It appeared all over my face. My cheek area, my neck, all the way to my back and my shoulders.
Every person, their skin needs are going to be different. So that's why I want to sit down with a patient and find out their problems or what they're looking for and come up with a formula that are specific for their skincare needs.
Chau gives you that special care where she'll sit down and spend the time to discover what your needs are and what you want to look like and give you the product that's appropriate for your skincare.
I believe that one size does not fit all, and it shouldn't fit all. There are a lot of brands and there are a lot of products out there. So for me, I believe in simplicity and cost effectiveness.
I have to use at least 5 products per night for my regimen. This is what I got from Pleasant Skincare. There's only one product that I have used to achieve the result I wanted.
I can customize whatever you need into one bottle, and it not only decrease on the amount of products you have to buy, but it also decrease on the amount of money that you have to spend. And it will decrease on the amount of time that you have to spend on your face and your skincare regimen.
I've been using Pleasant Care pharmacy products for about a year and definitely seen the difference.
I like Mommy's cream so much.